Hello, my nursing students. This is Professor Anil Gupta. Earlier, I had served as Dean Research and Professor in a reputed university. My videos, my slides shall cover the syllabus of Human Anatomy and Physiology strictly as per the syllabus recommended by Indian Nursing Council. My slides, my videos are thoroughly prepared as per the syllabus. These videos explain the difficult concepts very easily. Language is kept simple and clear. The concepts are fully explained with the help of colored illustrations, manually prepared diagrams, and I have provided rapid revision points for your quick revision and memorization. Today I shall start with the topic Human Anatomy and Physiology. We are taking a Unit 1 of Human Anatomy and Physiology. Then Unit 1 is regarding the anatomical landmarks and body organization. We start with the introduction to the term anatomy. Anatomy is derived from a Greek word anatom. Anatom is made up of two words, ana, that means through, and tom, that refers to cutting. So literally, etymologically, anatomy refers to cutting through or dissection of a cadaver to reveal the internal structures of human body. So regarding a definition of human anatomy is a branch of medical science in which we study the structures of body parts, internal as well external. Next topic is regarding a history of anatomy. History of anatomy dates back to the ancient civilization. It's around 3000 BCE. In Egypt, those people were familiar with the cultural practice of mummification. Mummification is a cultural practice in Egypt that helps to preserve the dead bodies. That signifies those people very well aware of the internal anatomy of human body. So next period come the 1600 BCE. In Egypt, there were medical texts, those called Ebers Papyrus. Those medical texts described about the internal organs and blood vessels. Next come the period of 600 BCE in India. There was a medical text named Sushruta Samhita. It was written by Sushruta. This Sushruta Samhita described the bones and surgical techniques. So these facts indicate that the knowledge of anatomy dates back to the earlier period. Next come the Greek period, around 300 BCE. It was Aristotle who was first dissected animals, and he described comparative anatomy of animals. In 1500 period, it was Andreas. He was labeled as father of anatomy. He published a book named as De Humani Corporis Fabrica. In a modern era, we have Gray's Anatomy. It's an important voluminous book describing the basic fundamentals of human anatomy. And after a discovery of microscope, we started the practice of preparing slides of soft tissue, and this branch developed into a branch of histology, study of body tissues. Contemporary anatomy, we are using imaging techniques like X-rays, CT scan, MRI scan, with the help of which we can view the internal body parts. A recent technique has been started by Gunther. He adopted a practice of plastination. Plastination is a process by which fat content and water content of cadaver are eliminated, and the cadaver is filled with synthetic polymer. It preserves the body for a prolonged period for the purpose of study. So, today we have 3D models with which we can perform a dissection. So, these are the advancement day by day, and it has become the modern techniques of study of anatomy by radiology, by plastination, by 3D simulation. These techniques help to understand the basic details of anatomy. Now we study branches of human anatomy. Anatomy had wide application. As a consequence, human anatomy is further subdivided into various branches. These are macroscopic anatomy, is a microscopic anatomy. We have developmental anatomy. We study the body parts by surface anatomy. And we have branch of anatomy applied to clinics. And the most developed branch of anatomy is the radiological anatomy. Now we shall discuss in brief one by one. First, I take up the macroscopic anatomy. Macroscopic anatomy is also called gross anatomy. In this branch, study of body parts, external morphology, external landmarks, which are visible to the naked eye, are studied. For example, I have taken an example of a human heart. Human heart macroscopic anatomy refers to the study of location of heart, that is located in mediastinum between two lungs in the chest. Then it deals with the study of color of heart. We study size and shape of heart. We study the division of heart, like it is divisible into auricles and ventricles. Next branch is microscopic anatomy. We study minute details of body structures which are not visible to the naked eye. We make use of microscope. Says again, I take an example of heart. When we study the microscopic anatomy of heart, we take a cut section of myocardium, we prepare a slide, and we study under microscope. Histology of myocardium reveals the normal structure of myocardium, and it helps us to find out any deviation in the normal structure of myocardium. Third branch is the developmental anatomy. We study in this branch the development of embryo right from zygote formation till the stage of complete development of embryo up to third trimester. Developmental anatomy helps us to find out any abnormality in developing embryo. Fourth branch is the surface anatomy. This branch, we study external surface landmarks and we find their relationship with the deeper body parts. Here I have quoted an example of surface anatomy of femoral head. Next branch is the radiological anatomy. In this branch, we study the parts in deeper region of the body which are not possible by naked eye. We perform X-rays, CT scan and MRI scan. We get a radiographic image and we can study it to find out the normal features and deviation from the normal features. We can detect, for example, a fracture in a bone or a stress fracture in a bone. We can make use of CT scan or MRI and we can find out, we can locate the area for a fracture. Next branch is applied anatomy. It is also called clinical anatomy. In this branch, there is a correlation between the study of normal body structure and their relationship with a diseased body structure. We find out deviation from the normal to the diseased portion. Suppose coronary artery in general has a diameter between 3 to 5 millimeter. This normal diameter is necessary for blood flow to myocardium. In case of narrowing of this diameter due to occlusion of coronary artery by deposition of fatty plaque, which we called atherosclerosis, blood flow to myocardium is reduced, leading to development of coronary artery disorders. So applied anatomy helps to find out the deviation in internal body structures with the help of different imaging techniques. Now next topic, we start with the study of anatomical terms. I have assembled all the anatomical terms into 4 groups. First group refers to anatomical planes. Second group refers to anatomical positions. Third group refers to body surfaces study. And the last one is body movements. Now one by one, now we shall study the anatomical terms. First we take up anatomical plane. Anatomical plane, that means an hypothetical flat surface which divide a human body into 2 halves. Depending on the direction, anatomical planes are of following types. First one is the median plane. Median plane is also called mid-sagittal plane. This is a vertical plane and it divides the body into 2 equal right and left halves. So just I will draw over here. It's an imaginary human body. If a plane which is vertical and passes from the top of the head, and then it divides the body in two halves. This is called median plane or mid-sagittal plane. Just another plane, paramedian plane, and is called sagittal plane. Paramedian plane or sagittal plane is also a vertical plane. It passes through the body on either side of median plane. Either it is to the right of median plane or left of median plane. So this means paramedian plane divides the body into two halves which are unequal. From the same diagram with yellow color, say this is the paramedian plane. Now this line, yellow line I have drawn to the left of median plane, or this paramedian plane I can just show over on the right side of median plane. So yellow line and violet line are the vertical planes on either side of the median plane. So these planes divide the body into two unequal halves and is designated as paramedian plane. Same is the diagram over here. It is shown as this line, black line. This is the median plane. The third plane is the frontal plane. It is also called coronal plane. This is also a vertical plane, and it divides the body into two halves. One is the anterior half towards chest, and other is the posterior half towards vertebral column. So the body is divided into anterior and posterior half. Fourth plane is the transverse plane, or is also called horizontal plane. This passes through the body horizontally, parallel with the floor. It divides the body into two halves. One is the upper half and other is the lower half, also called a superior or inferior halves of the body. So again, I will draw this diagram to make it more elaborative. When a plane which is horizontal or transverse, this plane is a transverse plane. It is parallel with the floor and divides the body into this half. This is a superior half, and this one is the inferior half. So this plane is called then the transverse or horizontal plane. And fifth one is the oblique plane. Oblique plane is a plane which passes through the body diagonal to the vertical and horizontal planes. It divides the body obliquely. So this plane, I said, is diagonal to one. It is diagonal to one transverse plane, and second, it is diagonal to the vertical plane. Here I draw a diagram. Now this is the vertical plane. This is a horizontal plane, and if out of this I take a plane which is an angle to these two planes like this one would be the diagonal plane, and it divides the body obliquely into one half and another half. So this is all about the plane which we have discussed. So regarding the study of anatomical terms, second aspect would be the study of anatomical positions. In anatomical positions, first position is the supine position of the body. This diagram, see the person is lying on a bed with the back touching the bed. And this supine position means lying on a bed with the back. And the face of the person, it faces upward or superiorly. This is a supine position. Just opposite to the supine position is the prone position. In a prone position, a person lies on a bed with the stomach touching the bed. As you can see, this position is a prone position with the abdomen or stomach touching the bed. Back is upwardly directed. This is prone position. Then another one is the lithotomy position. In lithotomy position, the legs are elevated, feet are supported. In this diagram, the person is lying, back and head are resting straight, legs are elevated at a specific angle, and the feet are supported. This is lithotomy position, and it is often used for pelvic examination. So another important position in medical science is Trendelenburg position. This position is the head down and feet elevated position. As you can see from this diagram, head is downwardly tilted, feet are elevated, and if you find a plane between the head and feet, head is at a lower position than the feet. And this position is specifically indicated to improve venous return and to improve blood circulation to brain. So just opposite to this is the reverse Trendelenburg position, where head is elevated and feet are downwardly pressed. And from head to feet direction, this is head to feet direction. So another position, very important position, is Fowler's position. Fowler's position is a sitting position where head and back of a person are rested, supported. Fowler position can be of 4 types. As you can see from the slide, all 4 positions are based upon the angle formed by the back of the person with horizontal floor. As you can see from this diagram, it's a sitting position of a person. Head is resting, back is fully rested on backrest, thigh and feet are resting. So there is an angle. If you draw an imaginary line from head to back and then compare it with a horizontal plane, so there is an angle between these two lines. If this angle is up to 30 degrees, then it is called low Fowler position. It is indicated for post-operative recovery of patient. If an angle formed between back and the horizontal floor is up to 45 degrees, then it is called semi-Fowler's position. This position is helpful when a patient after recovery is given tube feeding. It prevents aspiration. And the third position is when the angle between back and horizontal surface is up to 60 degree. This is called standard Fowler position. This position is helpful during feeding of a person, feeding of a patient, and it makes respiration easier for those suffering from respiratory stress, as in bronchial asthma and chronic obstructive pulmonary disorders. The standard Fowler position is advisable. And the last position is high Fowler position, where there is an high angle between the back of a person and the horizontal floor. This angle is up to 90 degree and is called high Fowler position. This is again indicated for respiratory distress. And overall, all the 4 Fowler positions I have provided in this slide, they are beneficial for preventing aspiration, helpful in nasogastric tube insertion, tube feeding, improves the venous return, helpful in breathing for bronchial asthma and COPD, and it's a advisable resting position post-operatively. Third aspect of anatomical terminology refers to the body surfaces, where we study first of all the anterior surface of the body. Anterior body surface is the surface towards nose, eyes, chest, as from the diagram we can see. So this entire interior surface of the body towards eyes, chest, ribs is the anterior surface, and this interior surface is also called ventral surface. Opposite to this is the posterior surface, is the surface towards back, towards thighs, and is also called the dorsal surface. Another surface is the superior surface. Superior surface of body refers to the surface towards head. Like this is the superior surface of head. And in this example, I can quote a relationship between head and neck. In these two body parts, if we have to find out the relationship, superior to inferior relationship, then I would say head is superiorly placed over neck. And just opposite to this, neck position is inferior to head. So in this way, these two body parts are related. So inferior position refers to the position of a body part towards feet. Like this is inferior surface. And this one is superior surface. And in this diagram, we can say this is the head region. And if I pass an imaginary line that passes from the top of the head, passes between eyebrows, nose, in the center of lip, through the sternum, and it passes through the pubic symphysis. This would be the median line, or we call midline. So any body part which is onto its right side is said to be on right surface, and body part towards its left is said to be on a left surface. So again, we have again two surfaces. One is medial surface, another is the lateral surface. What is the relationship between two surfaces? Any body part which is closer to the midline is said to be on medial surface, and a body part which is away from the midline is said to be on lateral surface. For example, ears are away from the midline are said to be laterally positioned, whereas the nose through which midline passes is said to be on the medial surface. Again, these diagrams, they depict the explanation of medial surface and lateral surface. Again, this is a more elaborative and color diagrams. So this is also referred to as the cranial surface or superior surface. Inferior surface we can also call caudal surface. And if this is a median line, so this is said to be on posterior or dorsal. This is considered as anterior or ventral. And this diagram shows the division of surfaces on right side and left side. This is the midline passing through the middle of the body, in the center of the body. And this shows two surfaces relationship. One is proximal surface and other is distal surface. Again, palmar surface. Palmar surface refers to the palm of hand. It is anterior surface. So dorsal surface of hand is the back surface of hand. Plantar surface, this surface refers to the surface of foot. That is the surface of foot facing floor while walking is the plantar surface. And dorsal surface of foot is the upper surface of foot towards shin bone or tibia. And this diagram depicts the surfaces. This is the palm area and is the palmar surface. And the back side of the palmar surface is the dorsal surface. This is the surfaces of a foot. This is the upper surface of the foot. And this is facing shin bone is the dorsal surface. And this surface faces horizontal plane is a plantar surface. Now, fourth aspect of anatomical terms refers to the types of body movements. Body movements are possible because a body has several joints. A joint is a close approximation of two or more than two bones that forms a joint. Depending on nature of joint, there are several types of movements which we will discuss one by one. First is the flexion movement. Flexion is a movement in which two body parts come closer and the angle between two body parts reduces. From this example, I will show how the flexion operates. Say these are two body parts. If this part comes closer to this part, then what would happen to this angle? Certainly the angle will reduce. This angle is decreased. Now we call flexion has taken place. Example is when we bend an elbow. For bending an elbow, the lower arm comes closer to the upper arm. As this diagram says, this is the lower arm. When it comes closer to the upper arm, the angle is reduced. This is called flexion. Opposite to this body movement, there is an extension. Extension is a movement when two body parts moves away from each other and angle between two is increased. This is an example of elbow straightening. In elbow straightening in this diagram, so this is the resting position. It's a lower arm and it's an upper arm. It's an angle formed. Suppose lower arm is brought to this position. So see the angle. Now the angle formed between two body parts is now certainly increases. This corresponds to extension. Another movement is abduction. Abduction is a movement when a body part moves away from the midline. Take an example from this diagram, I will elaborate. So this is a resting position of arm. When this arm is raised upwards, so it is now at this position. This is the midline, and now at this position, arm is away from the midline, and we call abduction movement has taken place. Just opposite to this, there is an adduction movement in which a body parts comes closer to the midline. It's another example, it's another diagram. In this diagram, this is an arm position, it is an elevated position, and it is away from the midline. And when this arm is brought closer to this position, this means the difference or the distance between midline and the arm is now reduced. It has come closer to the midline. This is said to be adduction movement. So another type of movement is rotation. Rotation is a movement of a body part when it turns around its long axis. Suppose it is a rotation of an arm. When an arm is rotated in such a way that during rotation it moves inwards towards midline and palm faces stomach, we call medial rotation. Just opposite, in lateral rotation, when we rotate the arm, it moves outwardly away from midline and palm faces outward, that is away from midline, we call lateral rotation has taken place. It's another another movement is circumduction. Circumduction is a type of movement where flexion, extension, abduction, and adduction simultaneously take part. As in this diagram, the girl is rotating the arm in circumduction way. So where all four movements take part. So another movement are dorsiflexion and plantar flexion. Dorsiflexion and plantar flexion are movements of a foot. In dorsiflexion, foot moves in such a way that the dorsal surface of foot comes closer to shin bone. For example, in this diagram, here in this movement, this is the shin bone or a tibia, this is the dorsal surface. During a movement, the dorsal surface comes closer to the tibia. Now this is dorsiflexion. In plantar flexion is the movement of foot when the foot moves away from shin bone and plantar surface faces horizontal surface. So during flexion, as we can see from the diagram, this is the plantar surface of foot while during this movement, so this surface moves away from the tibia and plantar surface come closer to the horizontal plane. This is plantar flexion. Another two types of movements are inversion and eversion. These are also the movements of foot. During inversion, foot moves in such a way that the plantar surface of the foot faces opposite leg. So this is the inversion. During this movement, you can just imagine is the plantar surface, it now faces opposite leg. In eversion is the outward movement of the foot. When plantar surface of the foot, it goes away from the opposite leg. So another movement is protraction. Protraction refers to the movement of mandible. In this movement, mandible comes in a forward direction, outwardly placed, because mandible moves around TMJ joint. So during retraction, mandible moves in a posterior backward direction. So another movement is supination and pronation. In supination, when a body part moves through supination, first point would be the palm always faces upward and radius and ulna are brought closer to one another in parallel position. As we can see from the diagram, here this is the palmar surface of hand. During this movement, it faces upward and the radius and ulna are placed parallel with each other. In pronation, the movement brings about two effects. One, palm faces downward and a radius crosses over ulna. Let's see this diagram. It shows pronation. There is a crossing of radius and ulna, plus this is the back surface of hand. It faces upward and palmar surface faces downwards. Thank you.